Hello everyone, I'm Dr. Tommy Martin. I am a doctor of internal medicine and pediatrics, and I am the host of today's webinar, Answers for Families about Coping with Anxiety. I am super excited to have an incredible panelist here with me, Dr. Keneisha Sinclair Mcbride. Welcome.
Thank you so much for having me.
Yes, of course. So Dr. Keneisha, she is a clinical psychologist, an associate training director of psychology at the internship program, and the incoming associate chief of integrated primary care in the Department of Psychiatry. She's been at BCH for 10 years and has a lot of her work focuses on the best practices for children and adolescents with anxiety and depression. So today's episode, Coping with Anxiety, is a huge topic in children medicine, pediatric medicine, adolescents, and I'm really thankful that we get to talk about this today. And it is a huge episode. We have had so many questions from all of the families out there, and we are so grateful for each and every one of you for submitting these questions. So something important before we get started is this is a live webinar, and we are going to answer as many of their questions as we can. And the great thing is that it is going to be stored on our YouTube channel. And so if you are not here with us live right now and you have friends and families that couldn't make this live webinar, you could refer them to it with a link that you could share with them, and they could go back and look at all of these questions and the answers in the future. So are you ready to get started?
Let's get started.
All right, so we're going to start off pretty basic, and that is, what is anxiety?
Yeah, let's take it to the basics to begin, right?
Yeah.
So anxiety is an emotion, first of all, right? It is something that's giving us a message that we're either feeling uncertain or nervous or uncomfortable. Everyone experiences anxiety sometimes, and that's totally okay. So when we talk about more clinically significant anxiety, there are different categories of that. So one of the first ones that people think about, the most common one, is generalized anxiety, and that's exactly how it sounds. Anxiety about lots of different general things in life, whether it's school, friends, the future, grades, like just kind of something in every category.
Okay.
And if a kid or teen has worries that are in lots of different buckets, that's more of a generalized anxiety presentation. Then we have social anxiety, which again, like it sounds, right? Everybody feels shy, everybody feels nervous sometimes. That's totally normal. We're a little bit nervous doing this, right? But if social anxiety keeps you from being able to kind of do the things you want and need to do and kind of withdrawing from kind of your social life, that's a problem. Similar, but often kind of more experienced by younger kids, is separation anxiety. So that's like having a really hard time separating from your primary caregivers. Again, most little kids have some nerves about that, whether it's separating from mom and dad at the beginning of the school day or a parent going on a business trip. But if it's keeping you from being able to separate from your child at all, that's a clinically significant issue. And then we have phobias, which are kind of specific fears about different things like heights or spiders or whatever.
Yeah, for sure. And I think something that's important to note is that with anxiety, it's not necessarily always a problem, right? Like anxiety is a normal part of development
100%.
in a young child as they go through different stages of development. Would you say that's correct?
I 100% agree with you. Basically, anxiety is a message that something's feeling uncomfortable.
Okay.
And that could mean that we should figure out some coping skills to help with that discomfort, or we should change the environment, or we should just sit and let it be, and it will pass.
Okay. And so when we, talking with our children, I think it's very important that we say, there's nothing wrong with you. Like this anxiety, like it is a normal part of us as you grow and as you experience different things that you're not used to. Anxiety is a normal part of development, but then there is a time where maybe we do need help with it.
Exactly.
Right?
Exactly.
And so with children, children are not just little adults.
Right.
Children are they're different. They are their own being. And so with that, how would you say that parents that are watching, and how could they recognize maybe my child's struggling with anxiety? Maybe they are showing signs and symptoms that they're anxious. What are some things to be looking at for that?
So one of the things would be to kind of focus on their behavior and their functioning. So if someone is really struggling with anxiety and they're a young kid, they might be clingy. They might say they have a stomach ache or a headache. They might say they don't want to go to school, these sorts of things. An older child or teen might withdraw a little bit, may also complain about the headaches and the stomach aches, may say they don't want to participate in certain activities. And also just listen to what they tell you. Kids have different language for some of this stuff. They might talk about worries. They might talk about, being scared. Older kids and teens might say they're overwhelmed or they're stressed. So those are messages as well.
Okay, yeah, and I think something that you touched on is that signs and symptoms of anxiety can be very different depending on the age of the child.
Yes.
So a 5-year-old that isn't wanting to go to school because they have stomach pain, maybe that is stomach pain, or maybe that is a sign of anxiety.
Correct.
Or a teenager that's staying in their room all the time or being very withdrawn. So that would be a sign. So at every age and stage, it could look a little bit different.
Right.
Okay, very good. And then here's another question about why do adults and children experience anxiety? So what is the root cause of this, or what's going on here?
So as we were kind of saying, right, there's some everyday anxiety that we all feel with like kind of just the typical ups and downs of life. But in terms of like things that cause people a lot of stress, for adults, it's kind of, those big issues like work, family, current events. Similar for kids with more of a focus on school, extracurriculars, social. I know it's a big topic of like social media causing kids anxiety and stress, but also can be a place where they can find community, but at the same time can cause a lot of that comparison sort of stress and anxiety.
Okay, yeah. And so with adults, I think a lot of our stressors revolve around work-related stressors or that job promotion or financial anxiety relating to that. And so, children, even though we both experience anxiety, there are different things that can cause it. I know for me, a lot of the times it is surrounding, maybe a stressful day at work might cause anxiety the next day. And then with both of us have children, I think our children probably experience anxiety in different ways as well.
Because kids are not out here having to necessarily like support their family and these sorts of things, but a school day can be super stressful. A hard time with your friends can be super stressful. They also can be worried and stressed about different events that occur. So it's kind of all developmental, right? We're kind of all experiencing the everyday ups and downs of life, but the things that kids are focusing on are a little bit different.
Yeah, for sure. So the next part of this, so we've kind of did a broad overview about what is anxiety, how it is a normal part of development for children, but it ultimately could become a problem.
Right.
There's different types of anxiety, as you kind of listed out, such as generalized anxiety, social anxiety, phobias. And then so if we see the signs and symptoms that our children are experiencing anxiety, how would you say we go about talking about this with our children, or what are the next steps there?
So one of the first things I always want people to know about when they're thinking about having these conversations with their kids is to just try to stay calm themselves and to be kind of open, because I think there can be a lot of stigma around mental health concerns, but taking care of your mental health is just as important and just as essential and connected as taking care of your physical health. So coming at it from a place of I'm noticing my kid is having a hard time and I want to talk to them in a gentle way to figure out, to investigate what more is going on behind this. Because we sometimes will see a behavior and panic about the behavior and not figure out why the behavior is happening. So there's that. And so starting out with those observations, I noticed you're saying you have a stomach ache before school in the morning. Can you tell me a little bit more about that, or what do you think is going on, and getting that little bit of information. There's also the fact that I think we should use different language with different ages. Younger kids, big feelings, worry, scared. Older kids, anxiety, stress, overwhelm, just to kind of connect with what they may be saying and hearing about, and not making it so that you say to a 5-year-old, do you have generalized anxiety? You're not going to know what that means.
What are you talking about, Mom?
But a 15-year-old very well might have looked up something about that and might want to talk to you about that.
Okay, and so what I hear you saying is a big part of it is having very open communication with your children.
Yes.
And I think making it a safe place to where they don't feel any stigma.
Yes.
They don't feel shame. They don't feel embarrassed to talk about these things, to really have an open conversation with you as their parent, as someone that they can confide in and say, these are the emotions that I'm having, these are the feelings that I'm having. How do I get help with it?
Exactly. They may not be ready to talk to you then. I think that's kind of disappointing sometimes, because families will be ready and they'll have their questions and I have my opening, or we're in the car and we've got this time. And maybe today is not the day, but leaving that door open to have, Mom, Dad, I'm always here for you when you want to talk about this, or I'm worried about you because I noticed X, Y, and Z, and we can talk about this when you're ready. Okay,
and something I noticed when you were giving examples of it is something we call open-ended questions.
Yes.
So what would be, say that a parent has concerns in their child that they think they have anxiety. Could you give some examples of maybe some open-ended questions just to start the conversation?
So maybe you're noticing that your kid is having performance anxiety about something at school. you could say something like, how are you feeling about the speech you have to give in public speaking tomorrow? Not like, you're nervous about their speech tomorrow, right? Like, kind of, you don't want to like feed them the information.
Okay.
Just because they might say, I'm feeling really good about it. I practice it so much, and I know I'm a little bit worried, but I'll be okay. Or they might say, I don't want to go to school tomorrow. Like, you don't know if you don't leave the door open for it to be more of a seeing kind of what they're going to give you, that sort of thing. Or how do you feel about X is a great one. Or what's coming up for you when you have to do Y, those sorts of things, versus assuming that they feel a certain thing.
Okay, fantastic. Yeah, I love how you said, like, do not say, I could tell you're anxious,
Yeah.
I could tell you have anxiety, but instead allowing them to kind of come forth and talk to you about that.
Yeah.
Yeah, and so I think something else that's really, really important is open communication with the parents, but also with their pediatrician.
Yes.
Right, and so with this, a pediatrician's job is to be in their corner and to help them along every step of development, and part of that is anxiety. And so I think for all the families out there and all the parents, that when you're looking for a pediatrician, find one that you really enjoy and that you feel that you could be open with, because if you feel that you could be open with, chances are that your child will as well.
Yes.
And that's something else to be open with your child with, is talk to them about how they feel about their pediatrician. Do they feel they could trust their pediatrician? Do they feel they could talk about hard topics with them? And to really find a pediatrician that they feel they could open up about these topics.
100%, because the pediatrician is going to be the person that, at your well child visit or a check-in, you can talk to them about, I'm noticing this is happening with my kid, and then we can start thinking about, referrals if that's necessary, or basic help and structure that can help you support at home.
Okay, fantastic. And something else that I think is really important when we're talking to our children, which we touched on briefly, but it'd be, how do we reduce the stigma about anxiety? Knowing that it's common amongst everyone, that it is a normal part of development. How do we talk to our children about this and reassure them that it's okay that they feel this way, and to reduce that stigma?
I think kids pay a lot of attention to the things we do, even more than what we say. So if we're acknowledging when we are experiencing anxiety or things that make us nervous and how we overcome it, I think that's super important. Because it's one thing to say, it's okay for you to be anxious, but then feel like you're not ever allowed to be anxious and you're not ever allowed to acknowledge your vulnerability as a parent. That's not going to really resonate, versus a kid being like, well, mom and dad say that it's okay to be nervous and they feel nervous about these things at work or whatever. So maybe it's all right. Or even the teenager will probably roll their eyes when the parents are trying to talk like this, right? But at least they know that it's not just them, they're not alone in it.
Yeah, I think there's so much power in vulnerability. And I think as parents, it's hard because we want to be their superhero. We want to be, their Superman, Superwoman, whatever. And it can be so challenging, but if we kind of break that tough act and say, look, I get anxious sometimes too, and I feel this way, and that's okay. I think there's so much power in that vulnerability.
Because the key here is that you're their hero, and their hero gets nervous and still does what they need to do anyway. That's powerful.
Love that.
Super powerful. That's resilience.
That.
That's super powerful.
Yeah, that's incredible. And so with that, I think that as we be vulnerable and we open up, it allows for them to open up as well. And then they see us open up, they'll want to do that to their pediatrician. It just creates a whole, I think, network of open communication, which is huge.
Because the secrets and stuff around feeling nervous, feeling uncomfortable, having anxiety are not going to help kids feel better. Right.
And then one other thing is, we've been talking a lot about how anxiety is a normal feeling. It is part of development. There is a time where it becomes an issue that might need help, that might need either referrals to a specialist, that might need medications. How do we navigate that? What does all of that look like? When do we know, this is normal development versus this is something that needs more attention?
Everybody can have a bad day or a hard day or even a couple days when things are getting to the point where the functioning level is just really getting low for a kid. Okay. In terms of, because if you think about what is a kid's job? Go to school, play. When you get older, maybe, doing your extracurriculars, maybe having a little, a part-time job or something like that. If you're not able to do these things anymore, that is a decline in your functioning. And as a psychologist, that's what we're paying attention to. If a child is not able to do the things they want to do, they need to do, they love to do, that's a problem, and that's time to start talking about, do we need to get some specialty support? Pediatrician can help with that. And there are evidence-based therapies that can really help kids to feel better and to learn skills.
Okay, yeah, and so with that, if I heard you correctly, it's if it is changing your child's ability to live a normal day for them.
Yes.
So if it's changing like what they would normally, like say you have a kid that is just so active and he loves to go to basketball practice and he loves to go to school, and then all of a sudden you start noticing really trying to avoid basketball practice and avoid school, then maybe that's changing their daily life, and it could be related to something else, or it could be related to the anxiety. Is that correct?
Right.
And something you could correct me if I'm wrong, but another part of it I think would be that if it persists after like constant or recurrent reassurance that you're telling them it's okay, but it still persists.
So reassurance seeking can be kind of tricky because a little bit of it is helpful, right? We all kind of want to know if things are going to be okay. But if you're starting to like kind of rely on mom and dad to tell you it's going to be okay before you feel like you can do anything, that becomes almost like a coping mechanism that you can't carry it everywhere. Like mom and dad don't go with you everywhere. So like how am I going to know it's going to be okay to go to basketball practice when they're not there, right?
Yeah.
So if you're noticing that you're having to do a lot of that to get through the day, that also is kind of actually a sign.
Okay, very helpful, very helpful. And then with this, if we've gotten to the point where we do think that the anxiety is altering their daily living, they're not able to go on every day normally because of their anxiety, what would be some first lines, some first things that maybe we talk to the children about to do to help cope with their anxiety?
So that's why we have some props here.
Okay, let's see what do we have. Let's see
So
it.
people always talk about, okay, we need to teach kids how to take a deep breath, take a deep breath. Like, yes, that's true. Breathing, relaxation exercise is super important. But there are things you can use to help with that. So like I have like these stickers.
Let's see what we have.
So these are like box breathing and triangle breathing. So it's like you breathe in, you hold, you breathe out, that sort of thing. And like this can be for younger kids, but older kids could like stick that on the bottom of their water bottle. No one else can see it. It's sensory too, and you can just secretly do it. Nobody would notice.
Okay.
Right? So breathing is key. And then all the things that are taking care of your body in a healthy way, right? Making sure you get good sleep, good nutrition, get outdoors, physical activity, those sort of like body maintenance things can help because body and mind are super connected. And when we're stressed and tense, we're holding all this like negative energy in our body and like all this tenseness. And that can really kind of be balanced out with some of that good stuff. And then trying to figure out what things help kids cope, what things bring them joy. Right? Is this someone who loves art or loves sports or loves music? Making sure they have those things in their day to help them de-stress. So those are like the basics for everybody.
Yeah.
And like, you know, we all experience some level of anxiety, so that's helpful for everybody. That would be a place to start, right? And then if that's not enough, then we're needing to think about like what could we do in a specialty sort of way. Okay,
so at the crux of it, or like the core, we need to make sure our lifestyles, and I think it starts with the parents, right? That we are also living the lifestyle that we think our children should, and so getting enough sleep, eating as nutritious of a diet as we can, and
with like treats and stuff too. Of course.
Yeah, of course, and we all love our treats, and then daily movement in any way that is possible for you and your child, and then these breathing movements. One question I had is, because I think your breathing one might be a little different, is there any key way to do the breathing, like a certain seconds?
Yeah, so there's so many different kinds. It's basically what appeals to your child, but the key is that when you breathe in, you're breathing into your nose, making like a big balloon, and then when you breathe out, that's the key. Then you can do it in a square, you can do it in a triangle, you can do it in a star, you can do it listening to a playlist, whatever, as long as you're kind of having those motions. This also is another little prop here.
All right, for, like, what's that?
Could be for younger kids, could be for older kids too, but like it's kind of like a meditation, mindfulness jar. You can make these at home, you know, put some food coloring sparkles in here, you shake it up, and then you kind of watch that settle and try to stay peaceful and calm as you're like kind of watching that all settle out.
That's nice.
Yeah.
That's like so calming. That is really nice. Oh, fantastic. And then, you know, with this, you know, with anxiety, the statistics show that it's very common.
Yep.
Okay. And we mentioned normal part of development, then it could cause issues with daily functioning. And it's depending on what literature you look at, it's about 10 to 20% of children who may need other management and things that you're talking about. So let's say that our lifestyle, we've done the best that we can with that. We've been trying the breathing techniques. We've bought an amazing, I don't even know what that's called, but an amazing, soothing, calming jar. And it's just still not working. Like, so what's the next step?
The next step is that there's really good news.
Okay.
Because we know that we have evidence-based therapy that helps with anxiety. For example, cognitive behavioral therapy.
Okay.
Like first line, we know that there's really good research that this helps kids, this helps teens, this helps adults to feel better and manage their anxiety. Basically, the key here is this idea that your thoughts, your feelings, and your behaviors are all connected. In CBT, that's what it's called, therapy, you learn how to work on your behavior and work on kind of changing any negative thought patterns to feel better.
Okay.
And there's lots of different aspects of this therapy, but that's what families should be looking for first to really get something that's going to target anxiety well.
Okay. And then part of that is, I think a lot of struggles that parents have today is like getting connected with that resource. So what's the steps of finding, okay, my children has anxiety that's causing problems daily living. We've tried these things that aren't working. How do I get to that specialist? How do I get to that therapy?
That's such a good question. So you mentioned the pediatrician being like the kind of that go-to person.
Yeah.
You know, connecting with them, they may have at their clinic a behavioral health specialist that can do a consult or a check-in to help you get some referrals or even get started with something like CBT. If you're looking for this on your own, looking for that the CBT designation for anxiety, for example. And I often say to people, email 10 referrals. That's a lot of people, that's a lot of work, but hopefully you'll get back on from some of those people and you'll get on some wait lists, and trying to utilize some of these strategies in the meantime, and even asking the pediatrician or the consulting clinician for some advice on like what kind of strategies to do in the meantime as well.
Okay, and then one last question I have before we get to some of the incredible questions that we had. We had so many questions from the families, and we really appreciate it. But medications, you know, we do have a lot of questions about this. Are medications indicated in anxiety, and when do parents start to ask for that or talk about that? What would you say? So
not being a prescriber as a PhD, I usually don't kind of go there, but definitely talk to your MD about this, because there's definitely support around this. Yeah, and so there are evidence-based medications that help with anxiety as well, and I think that getting with a therapist and getting with a pediatrician that the parent and the child feels comfortable with to talk about these things is so crucial. And then having frequent follow-ups is very important, and I can't undermine that it is hard to get appointments these days. Oh yeah, definitely. And I know as a parent, that's a struggle. Yeah. You know, as a parent, you know that's a struggle, and so parents just know that we understand that it can be hard to get appointments. Definitely. But if you can make that happen and have frequent follow-ups with the pediatrician, I think it could be very beneficial, and with the mental health providers. Exactly. Okay, very well. So one last thing before we get to some incredible questions, is there any last things that you'd want to say to the families out there before we start answering some of their questions? Just that I know it's really hard to see your child struggle, right? And it's really hard to feel like you don't know what to do, but the most important thing is that your child knows that you're there for them, that you're open to hearing what they have to say, and that you want to figure out a solution with them. I think families want to solve it right away, and like, unfortunately, anxiety, that's pretty significant. It's not something that's going to magically overnight be fixed, but if you work together with your child, stay patient, stay open, and stay there for them, you can make a really positive change. I love that so much. I think one of the most important things we could do as a parent is to be present. Yes. So thank you for sharing that. Okay, so let's get to some of you guys' incredible questions. And again, thank you so much for sending in all these questions. I wish we could get to all of them, but there was over 100. So we're going to get to some of them, and hopefully maybe in the future be able to answer some more of the questions for you guys. Okay, so the first one, if we know our child is sad or anxious, does it 100% mean that they need a therapist, or are there other ways that we could help them cope? We kind of touched on this, but you could answer it. But just to summarize, right, trying kind of those tools in the toolbox that we were kind of going over earlier is a great first step, because knowing that your kid is sad, knowing that they're anxious doesn't automatically mean they have to go to therapy, but if kind of these lifestyle strategies don't work and don't help, then it might be time to kind of consider it. Okay. Very good. The next question is, how do you provide strategies for a child when they say they are not anxious, but you can obviously see that they are? I think you don't have to argue about it. Okay. I think we should just try to do the things without, we don't have to call it that. We can call it something else. If the kid refuses to acknowledge that they're anxious, but they're willing to learn meditation, cool, that's fine. Or if you just want to take walks, that's good too. We don't have to call it anything as long as you're getting help for your symptoms to feel better. Yeah, and something that I love that you said earlier is that you may try to be open and talk to your child about it, and they may not be ready. It might not be time. And so it may not be time. And so I think
continuing to be open and taking our feelings away from it, like our frustration that they're not opening up to us, our sadness that they're feeling anxious and they won't talk to us about it. Take that emotion out of it and allow them to continue to talk to us.
Because it's justified to feel that frustration and want to help them. But we might need to hold on to that and give them that space.
Okay, yeah, fantastic. And then one more question. How to help know the difference between anxiety and potentially other medical conditions. We talked a lot about maybe stomach pain or something like that. How can we tell the difference?
I mean, the stomach pain one is because it's such a constant description for little kids, because when you first start having that bodily awareness and like that nervous feeling of like your stomach churning, they can call it their stomach hurt, right?
Yeah.
But there could be some other medical thing underlying it. So first stop, like we keep saying, right, is pediatrician. If we make sure that like there's no underlying medical cause, then we're seeing that this is kind of an anxiety symptom. And now how do we use some of these lifestyle strategies to manage it? And if that doesn't work, how do we work on getting some therapy support?
Fantastic. Well, Dr. Keneisha, I think that's all the time we have for the questions right now. I cannot thank you enough for coming on the webinar, sharing your expertise with us, and helping answer a lot of questions that these families had submitted to us.
Thank you so much. It was wonderful talking to you, and maybe we'll have to do it again.
Yeah, I think we'll have to. With all the questions we had, we'll definitely have to do it again. And to all of the families out there, thank you so much for joining our webinar today. We will be doing these monthly, and if you guys want to stay connected and learn more about the questions and answers, they're going to be on all of our social media accounts. You could go to the YouTube channel, and they will be archived right there under the Answers for Families, Coping with Anxiety. You can watch it at any time, and of course, share it with your friends. So until next month, thank you guys so much.
Thank you.